Hi, my name is David Tsai. I'm a family doctor here in Edmonton, Alberta. I'm here to bridge the gap between the two opposing views regarding the coronavirus that are currently floating through the news and social media. We have heard some people say it is an infection, just slightly worse than the flu, and we have heard others saying this is much worse than the flu with disastrous consequences. If you are caught in the middle and you feel confused, well, you're not alone, because in fact, both views are technically correct. But it depends on the context and who your target audience is. For the individual who might be affected by the coronavirus, please be reassured the vast majority of people will experience a flu-like illness, possibly a little worse, as more than 80% of the people will be fine just at home. Close to 20% will need some sort of medical attention, and including 5% of people requiring intensive care. However, there is also a 1 to 2% case fatality rate, which, depending on how you look at it, is quite a bit or just a little bit worse than the flu, which is around 0.1 to 0.2% fatality. So again, from a strictly virology and physiology point of view, for the majority of us, on an individual level, especially younger and healthy individuals, there isn't much to fear, and that it is probably just a little bit worse than the flu. However, for society at large, the coronavirus is nothing like the flu and will have disastrous consequences. The flu already causes a great amount of impact in terms of healthcare spending. This is already curbed by the fact that we do have an antiviral specifically against the flu, that there is a vaccine, and that since most of us have had the flu at some point, there is some residual partial immunity. These three factors keep the denominator of the susceptible population to a manageable level for our healthcare system. However, COVID-19 is a novel virus to which none of us have any immunity, and therefore the entire 7 billion people on Earth would be the susceptible denominator that, coupled with a larger percentage of people having more severe illness, would mean that any country will be easily overwhelmed by a surge of patients being severely sick with the virus at the same time. This is precisely why governments around the world have gone into lockdown, trying to limit this pandemic. If we cannot collectively be proactive in limiting the spread, then we will also simply be forced to becoming reactive in closing public venues and locking down entire cities. If we are not proactive in prevention, the stock market will continue to tumble. The hospitals will not be able to cope with the influx. Our Alberta and Canadian oil industry will be at risk, and all of our jobs will be at stake. We do not need to overreact, but we all do have a role in this healthcare crisis by practicing good hand hygiene, general hygiene, and social distancing. To quote from Dr. Campbell and President Lincoln, healthcare must be by the people, of the people, and for the people. So if you unfortunately become sick with the coronavirus, please stay at home and remind yourself that yes, the coronavirus is just a little bit worse than the flu, and you will probably be fine recovering on your own. However, until we become sick, we should probably all stick with a proactive, preventative approach that, because this is much worse than the flu, and if we do not collectively deal with this pandemic, then all the aspects of our lives will be affected. And therefore, yes, it is a little bit worse than the flu, and yes, it is much worse than the flu. Thank you.